Share with us how your foundation and social work supported and or conflicted with the principles of play therapy.
Well, there are both differences and similarities. The main similarity is that both social work and play therapy really emphasize the importance of the relationship. And so that's the beginning of all the work that we do, and that's very similar. Social work tends to emphasize the family, and one of the differences between play therapy and social work is that sometimes the child gets lost in the family focus, and I've tried to really educate social workers about the importance of dealing with the child on the child's terms, not just as a member of the family. And so therefore, one of my books is Social Work Practice with Children, in which I really do talk about play therapy. And but most schools of social work do not teach play therapy. It's more evident as a postmaster's program. So there are similarities and differences, but I think it's getting a little closer than it used to be.
How do you perceive the current state of play therapy?
Well, I think it's alive and well, as evidenced by the current APT meeting. Certainly when I began as a play therapist, it was a very small organization, APT, and now we have more than 6,000 members and lots of training programs. So I think it's growing in acceptance and doing very well.
How would you compare the first 5 years of your career as a play therapist to the last 5 years of your work?
Well, it's a huge difference, really. My first 5 years were in the 70s, early 80s. When I was first trained, the focus was very psychoanalytic. You were always trying to find out the diagnostic assessment of the child, the intricacies of why they were behaving a certain way. Now I think there's much more focus on helping the child, and maybe certainly the length of treatment has shortened tremendously. In the early years, it would be common to see a child for 2 years, whereas now insurance companies and also the methods of practice have changed, so that I think 18 sessions is far more common now than a longer period. So that's a big difference.
Briefly trace the history of how we have conceptualized children's reactions to death. Has it changed significantly? If so, how would you describe and explain that change?
Yes, it definitely did used to be, don't talk about it. If we don't want to upset them. Let's not upset the children. But children are very perceptive, and they would realize something is going on. But they also would realize it's not okay to ask, it's not okay to talk about it. Now, and children often would not be attending a funeral, even if it's a family member of someone they knew. And that as those children grew into adulthood, they would look back on their lives and really resent the fact that they were excluded. And rightly so, but that was just the practice of the times. But those people, many of them vowed to handle things differently with their own children, and they did try to include them more. Along with that, there has been tremendous growth in the literature about helping children understand death, and it educates not only the child, but the parents and the teachers in knowing how to talk with children. So it's times have changed very much, and the books that are out now, How Dinosaurs Die, books about Alan Wolfelt has written and has tape about helping children understand death. These things have helped tremendously. But the other thing that I think has contributed to the difference in the way we handle the topic of death with children is the tremendous exposure in the media, because since the dramatic deaths of 9/11, Columbine, Newtown, it's right in the child's living room. They see these tragic deaths, they know about them, and so therefore parents and teachers and professionals all have had to learn how to not exclude the child anymore, but to help the child understand to the extent that they're able to comprehend it.
What things have grieving families taught you about the field of bereavement?
The most important thing is that for children, their understanding really depends on their developmental level. The younger child simply doesn't have the cognitive ability to understand that death is final and non-reversible. And this happened in my own family with a very bright granddaughter who attended her other grandfather's funeral, observed the dead body at a wake in the coffin. She saw her grandfather in a coffin, and then saw the burial, actually, and people threw flowers on the grave. Well, a few months later, it was Father's Day, and the whole family was assembled to recognize fathers, and she looked at her other grandmother and said, "Where's Grandpa?" The young child thinks that although they may understand dead means dead, but they think they can come back for their birthday or Christmas or some special occasion. So we have to really be gentle with children, young children, because parents sometimes get annoyed that the child doesn't seem to get it. Well, it's not because they're stupid, it's just their developmental ability is not at the point where they understand that death is final. Now, the other thing that is important that I've learned in my years of work is that with the adolescents, the older child, the teens really do understand, and they will think and feel deeply about and ponder the question about why did this person die, what's going to happen after, and they really need a lot of support from adults and the ability to talk about the meaning of it. It's important for them to comprehend it.
You've written a great deal about dramatic events in play therapy. What is the best advice for a play therapist who is looking to begin work in the area of trauma?
Well, I think the most important thing is to have a plan for self-care. Otherwise, there's the danger of becoming overwhelmed and overburdened with taking on the pain of all their clients. I'm actually presenting on that topic tomorrow. I have the term empathy overload that I have coined, which really does talk about and refer to the fact that so many therapists, especially child therapists, especially young students, become really angry and sad and feel helpless about why should this poor child have to suffer. And they may feel that everything is unfair, and after a while, it affects their ability to do their work in a appropriate way. So that's one thing to be for a new therapist to working with trauma clients to be aware of is you have to find a way to set up a boundary between yourself and your clients. And another thing is to go to conferences, continue to learn, and get good supervision. That is important. And many agencies no longer offer regular weekly supervision, so I think it's incumbent on a practitioner to find a way to either get supervision privately or to join a group where cases are discussed among colleagues, and help can be obtained that way. And that will help them deal with their own feelings and keep them interested and able to continue to contribute to the field.
How have your views of children's needs in play therapy changed since you began your career?
Well, I'm not only a child therapist, I'm a professor. So as an educator, I tend to talk a lot. And as a child therapist, I have learned more and more to say less and less. And as I supervise child therapists, beginning therapists, I tell them what one of the wise supervisors I had once told me: you have to trust the process. You don't expect to discuss it with the child, just trust it, and you will see the progress, whether or not the child can verbalize it, because the chances are they won't be able to. I just finished a chapter for a forthcoming book on why children clam up in therapy. And my chapter is related to using play therapy with selectively mute children. Now, the selectively mute child may never speak a single word in school, and often when they come to therapy, they don't talk. And someone said to me, well, how are you going to manage that? I said, well, the child can play. We don't have to talk. I will talk a little bit, but so I think the biggest difference that for me personally is to learn to continue to trust the process and not to feel that you have to verbalize everything.
What metaphor or image would you use to define the field of play therapy over the last 15, 20, or 30 years?
I thought about it, and I'm thinking maybe sports. If you think of trying to run a race and you're going to have to get water as you run a marathon, you stop and get refreshed. You're with colleagues, and some are ahead of you, some are behind you, and you just continue to try to keep going and get to the finish line and to celebrate when you get there.
What do you imagine will be the major focus for the field of play therapy in the next 15 years? And what suggestions do you have for play therapists in the future?
We know that there's been an increasing interest and use of empirical research to actually document the validity of play therapy, and that is important for the general public and for other fields who are less aware of what play therapists do. I continue to, that is one thing that's very important. I think the other thing that's very important is for play therapists to have a good understanding and ability to use a range of different play therapy modalities, not just to stick to sand tray if they're trained in that, but to be able to use doll play, storytelling, art, music, whatever, because I think we have to be always sensitive to what's going to work with a particular child. And it's not what we are trained to do and what we would maybe prefer to do, but what's going to work with this little kid, and how will they respond to that. So I think we have to be versatile and to be comfortable with using different play therapy methods.
What do you hope to leave as part of your legacy in regard to the field of play therapy?
Well, of course, I guess I have to mention first the books that I've written. I'm very proud of the first one I ever wrote was Play Therapy with Children in Crisis. And that now, as of this past August, just came out in its 4th edition. And it's totally revised, totally new authors, chapter authors in that. And this time, we have decided to go along with the suggestions that were made by practitioners who read it and professors who used it in teaching, to add content about adolescence. So the book now is titled Play Therapy with Children and Adolescents in Crisis. So I'm proud of my books. I'm also feel very good that I did start a play therapy training program at Fordham University in New York. This was back in 1985, and it lasted for 22 years until I retired and left Fordham. And we trained in that, probably close to 200 play therapists. They were all postmaster's level, and I feel very good about that. And I think those are the two things that I hope will live beyond me and continue to have some effect on students and practitioners.